since you both came into working in eye healthcare, what do you think has much changed for good and not so good? Do you think much has changed? Do you think there's more awareness, or do you think it's getting harder? And particularly now with COVID-19, do you think we've taken a backward step, or do you see that actually things are still continuing as they should be?
For my country, I would say we have gone a long way in eye health. When I joined eye health, it was really in bad shape. There was no eye health at all. It was like, for example, in the province where I work, we had 4 million people, and we just had 1 ophthalmologist and 5 ophthalmic technicians for 4 million. So we can see that the difference was too big, according to what IAPB has recommends for eye care staff in Africa. So since then, we have been working, doing an advocacy work for more recognition of eye health in the country. And I think it's paying off because now we can say that we don't have the right numbers of ophthalmologists in the country, but at least in Nampula now we have 3 ophthalmologists. Of course, it has been 10 years, but there are 3 ophthalmologists. We have more than 47 ophthalm technicians, which shows an evolution. In the past 2 or 3 years, the optometrists were recognized because they were not there, and they are doing a valuable work and releasing some staff from the ophthalmologists so the ophthalmologists can concentrate more on clinical aspects. So we have improved a lot. We didn't have, like, our indicators were not in the national HMIS system, but now they're there in the past 2 years, and many things.
For me, something that I've seen that has really personally really helped me my everyday job, especially when it comes to trying to explain to people who don't come from the eye care world how complex the vision care is and what needs to be done, is the WHO report that was launched recently with IAPB. That made a significant change in what I do, because suddenly you have a document that is tangible with data and explanation of how to articulate the problem.
COVID has really impacted the eye care in our scenario, one thing is a lot of things are happening. The corneal eye buttons for corneal ulcers, and on the other hand, we have ulcers, going to the next stage where patients are not able to get the eye drops. So I think that will, that impact, I don't think we will see it now, but I think it will have a greater impact in the coming years.